Welcome to our platform. Please introduce yourself to the audience.
David Omontayo Ikudiasi.
Omontayo. Thank you. Carry on from there, sir.
Yes. Hello, everyone. I am Dr. David Ikudiasi. I am a board-certified internist. I practice in the state of Florida in USA.
Can you tell us a bit about your childhood, a bit about your background, what state you are from in Nigeria, how you grew up, what schools you went to, and what influenced you in those schools, especially your secondary school? It will be a pleasure to know some of that, sir.
I was born in the city of Osogbo, but I'm actually a native of Rio, Ekiti, in Ekiti State, Nigeria. I, started my primary school at Ado Ekiti. Then later on, got admitted to Federal Government College in Duani, in Ondo State. And then from there, I got admission to study medicine at University of Ibadan. During my secondary school, I happened to be very good in further mathematics and physics and electronics as well. So my first choice of career was to become an aeronautic engineer, but you know how difficult that could be in Nigeria and all the logistics. So I had to go for my second choice, which is to become a physician, to help people, to become a doctor. And I was able to get admission to University of Ibadan. I was admitted on merit. In those days, that means the first 10 candidates based on the JAMB result. So I was in UI for 1 year, well, not even a year yet, before the president, Babangida then, closed the university down. And then at the same time, I had applied for BEA, Bureau for External Aid Scholarship, to study abroad. So after 3 sets of interviews, based also on my secondary school result, Ondo State had 3 spots: one for medicine, one for agriculture engineering, and I think one for chemical petroleum engineering. So I won this federal government slot to study medicine. And I was given the option of 3 countries, of which my choices were not there. So I had to choose from Czechoslovakia, Romania, and then USSR, the Soviet Union. So I ended up choosing Soviet Union. And then because the UI was closed down, so I decided to go and study medicine abroad. So I ended up in Russia, now called Russia. And I did my medical schooling there. I learned the language for 1 year, then entered medical school and stayed for the next 6 years. And when I finished, I decided to further my education by coming to America. I had some cosmetic surgery training for a couple of months in Paris, France. Then finally ended up in USA. And I did my fellowship training. I started with internal medicine residency training, which was done in New York. Then after that, I furthered the education by doing fellowship training in geriatrics. And that's what landed me in Tampa, Florida. And after my fellowship at the University of South Florida in Tampa, Florida, I decided to stay in Tampa. And I've been practicing. I have some clinics, and from treating my patients I got interested in a new field of medicine called regenerative medicine. It's kind of 20 years relatively old now, but I mean relatively new compared to other fields of medicine.
Yes.
It's been in existence. Actually, the word regenerative medicine was first coined in 1992, but in the last 20 years, it's become popular, and it's a new field of medicine that is offering hope for most of the conditions that the country have now that we have no cure for. And some of it are in research stages. Some are already clinically safe and they are clinically available. But they are really not being covered by health insurance yet. And because the FDA too has not given a full clearance to some of it, because most of it are still in research stages. So for those that are hearing for the first time about regenerative medicine, it is a field of medicine that, focus on using cells, tissues to repair, regenerate, rejuvenate, and restore damaged organs, tissues back to normal functioning state. And this can be done by using the patient's own cells and tissues or from a donor. So that is what regenerative medicine is, bringing things back to normal state and using the cells in the body without actually using any drugs or chemical compounds.
We'll come back to regenerative surgery. I want to take you back. FGC Ikudiasi, a beautiful school. What motivated you in that school? Who were your, who did you look up to? What teachers encouraged you in the direction where you were heading? I know we had a very good further maths teacher. I remember some teachers like Mark Boma of physics.
Mark Bo.
I remember the maths teacher of blessed memory now.
Yes.
Is that Mr. Adejayo?
I did, yes.
Yes.
Thank you. I'm like, how am I going to remember those names? But thanks.
Yeah, so tell me what did you enjoy about Ikudiasi? Because that school has produced quite a lot of it has a wealth of resource at the moment. If I look in the alumni, the wealth of resource is fantastic. So tell me, was it your first choice of school, or when you got in there, what did you think, and what motivated you to enjoy about the school?
You see, in those days, it was a thing of pride to be in a federal government college.
Absolutely.
Because getting in was really, really difficult. You have to go through, I think, is it a common entrance exam they call it in those days?
Yes.
In Nigeria, there was nothing, private school where they couldn't compete with federal government colleges. Federal government colleges were the top notch in the whole country. I guess when education was still education in Nigeria.
Absolutely. Yes.
So getting there, you have the best teachers, you have the best people to mentor you, starting from, we were actually the first set of, SS?
GSS and SS.
Yes, SS3, 6 or something system, whereby you do have GSS and 3 years and SSS 3 years. So we were like what they call it, guinea pig,
Yes, you were the first set. Okay.
We were the first set, So, but apart from that, even before then, federal government colleges happen to have the best teachers. So, and they also admit supposedly the best candidates from all over the country.
Yes.
And then with everybody having knowledge to share among the students, then being mentored by knowledgeable teachers. There was a lot that federal government colleges were offering us. We used to have an inter-school debate, and then everybody wants their school to be the best. So when you were actually, let me focus on the senior secondary school. That is the SSS section.
Yes.
Like you mentioned in physics, Mr. Magbo, he was always there to help. He will push you to make sure that you do better in the next test, that you do your homework. Late Mr. Adeyonju, it's like he was further mathematics teacher. The way he explained it, he gave me should I say, how do I put it? The attitude of believing that there is really no problem that does not have solution. It's only that we human beings might not have thought well enough at that point to find the solution, but there is always solution.
Sure, to any
and then because
equation.
Of that, I can say that throughout my 3 years as a senior secondary school for the mathematics student at FGC Journey, there's only one question I could not solve, especially in my last 2 years.
Are you able to solve it now?
Oh, yeah, no. What I mean is, my colleagues brought questions, nobody could solve it in the book to get the answer.
Yes.
Only one question, and I said, well, you know what? I have to give up. And so I went, and the next day we went and meet later. Adejayan. And when he broke it down, we just saw where we went wrong. So minute, So my point is, with that kind of attitude that you keep looking for the answer, you keep looking for the best, you want to be better, and that is everybody in the set was good. That is why, like you said, FGC Journey has produced a lot of reputable people in the society all over the world. It's because of the background that we had. The sports time is there, the resting time after school, after lunch is there, then the time to study in the evening. I think we have afternoon class too to study after class. Then later on we go back to the class to study in the evening. So it was organized. And then on weekends, I think we used to have a social gathering on Saturdays. So, I mean, it was...
Who were your friends for social gathering? What house were you?
I was in Red House.
Ah, Red House.
I'm going to say everybody was my friend because trying to put me on the spot.
Who was your best friend?
Oh, well, Justin Awe, he's also a doctor, was in UK, then, he's currently now in Canada. So, yes, in those days, everybody always have like one pally you all hang out with. So during that time, even though I was wrong with everybody, the one unique person that you could probably, associate with then always was Dr. Tosin Awe.
Okay, that's brilliant. Now let's move to Ibadan. You say you were there for just a year before was it the SAP riots?
6 months.
6 months before the SAP riots.
Sorry.
I think that was in 1989 when they had to close the schools down.
Actually, let me just clarify it for you.
Go on.
I entered UR to study medicine, and I think we started in August or September 1988. Then by December 1988, the then president, shut the school down, and we all went home. Even by the time I traveled to Russia in August 1989, UI was still shut down.
So there you are in Russia. You've never been there.
No.
I'm sure it's a cold country. You don't speak the language.
Right.
What motivated you? How did you learn to speak the language? Yeah, how did you find your stay in Russia? Give us a bit brief, a brief history of that period in the Soviet Union.
All right, let me walk you through the process. I entered UI to study medicine, okay? And then when I found out about the Bureau for External, BEA, Bureau for External Affairs, Bureau for External Affairs, when I found out about BEA scholarship, my intention was to study, to apply. If I went to study in the USA as my first choice, if not, Germany as my second choice, and if not, France was my third choice. Those are the only three choices on my form. And then at the time I was offered to study in USSR, Soviet Union, UI was still closed down indefinitely.
Yes.
So I wanted to go somewhere where I could finish my education, whereby if I start today, I know after XYZ number of years, I'm going to finish without any disruption. So that was what was behind my reason for leaving Nigeria, to go abroad, to gain the knowledge, and then, bring it back home. So that's how I ended up taking the offer. I did not know a single word or letter in Russian language. When I had my visa, passport, everything. I got to the airport, I saw the Aeroflot, I saw the name of the airplane written on it. I'm like, so that is the language I'm going to, one of the words I'm going to have to learn. So, you were young, like what, 20 years then or so, and then or 19. All you wanted to do was, just move on, travel abroad then too. So with the hope of coming back home to help the country after getting the knowledge. So I jumped on the plane, I landed in Moscow, and then they welcomed us. There were some older student Nigerians who also welcomed us. They made us comfortable. And within a couple of days, we were all posted to different cities in Russia. I ended up in Rostov-on-Don, which is south of Moscow, also within the Russian state. That is where I stayed for 1 year. And that is where I learned the Russian language. So we were started on the alphabet, from ABC to what is equivalent to Russian language. From there, mathematics. So it was mathematics and Russian language most of the time. Literature, reading, paragraphs, the books, the different novels and all those things, and textbooks for literature. So by that, we did that for 6 years. For 6 months. So by the time we came back from vacation, your teacher that you will speak English to, if you couldn't express yourself properly in Russian, by the time we came back, it's like you speak English, they look at you and say, give that expression like, sorry, I don't understand you. So they made us to speak the Russian language.
Wow.
So then by that time, they started learning the physics, the biology, the chemistry, all in Russian language, preparing us for the medical school. So after the 1 year of language, then we were all posted to different institutes, universities. So if you are there to study chemical engineering, you go to the appropriate school. If you are there to study medicine, you send it somewhere. If you are there to study agriculture or whatever, So that is how we are all posted to our individual universities. I was sent to Moscow because then they give us an opportunity to pick 3 choices.
Okay.
So I chose Moscow, and I was sent to Moscow to study medicine, and I ended up in the best medical school in Russia, and they call it the the first Moscow Medical Academy, in the name of Sechinov. So that is where I did my 6 years of medicine. Oh, interesting part.
Tell us, please.
They threw us in lecture room with the Russian. The lecturer don't care that you are foreigner or not. They don't care that you've only learned the language for 1 year or not. So, because you take lectures in Russian language, you read Russian textbooks, you give your test orally in Russian language, then written in Russian language. So the interesting part in the first couple of months was when we were taking lecture, you just writing your notes, then you have to skip because either you did not hear properly or you couldn't follow fast enough. Then you go to the next paragraph. So at the end of the day, you have to look for one of your Russian colleagues to give you their lecture notes so you can fill in the gaps.
The blanks.
So that later on, when you read your notes, it will make sense. It was a lot of work, but it's worth it.
It is. It's absolutely worth it. Do you think the Soviet Union teaching their indigenes in their language has helped develop the country more than, shall we say, in Nigeria now, where there's not one unique language apart from English? We have various dialects. Do you think if we had just one Nigerian language, would that help? Would that have helped Nigeria?
It's not just Nigeria, any country, any nation. There was an article I think I saw on social media or one late professor from the Southwest comparing I think a Yoruba kid with a European kid. You see, when you speak your local, let's speak Yoruba for example, you train the kid in that language. You speak it to them at home. That's all they know. To name table, to name pencil, to name books, they know everything in that language. Now, when they now get to primary one, now you're not comparing them to an European kid who knows only English. Both of them in primary one. You now start teaching them whatever the curriculum, based on the curriculum of the school, it's new stuff. A kid that has been sharp at home, that can handle stuff. Now, comparing to the European kid, you're not asking both of them to read a book in English. Obviously, the European kid, that's his language. We have no problem assimilating the new information. It's going to sound like Greek to the poor Yoruba kid that even probably, it's even going to be blessed if his parents even know English, sadly. So now you're asking him to compete with the European kid. So the time he's trying to accommodate, understand what the word means in English, translate it to Yoruba, or vice versa, the European kid has already taken 3-4 steps forward to eat that piece of cake. That's something he already knew from home.
Yeah.
So this Yoruba boy now be facing challenges, doing double work for his brain to catch up. So then the ground is not level for both of them. So what I'm just trying to say is that if our core language is Hausa, Igbo, Yoruba, and your thinking is in that, you are reading a book or trying to understand a textbook or research is in that language, your processing will be faster, easy.
Okay. Yes.
Smoothly. So I just want to say, yes, I agree with your, with your statement. But how is that going to be doable with where we are now? I don't know. Because all these are things that should have been thought of from the time of get independence.
Yes.
There's nothing wrong in learning French, English, but keep your own language
as the
and
main.
use that in your education as you grow.
Yes, education would have been quicker and easier for some
the German,
children.
They speak their language. The Chinese, they speak their language. That doesn't mean that they don't have to speak English. But everything Japanese, all of them, including Russia, everybody keep to their native language.
Absolutely agree.
But
So,
anyway,
so 6 years, quickly, it comes very quick. 6 years, you finish,
sure.
you become a doctor. Were there offers for you to work in Russia, or did you immediately return home, or did you from there advance to America?
Okay. In Russia, I don't know of now, but in the 90s, when I finished in 1996. Then, as a foreigner trained in Russia, you are not expected to stay back and treat their citizens. The agreement with your country is that they will take you, train you to become a doctor, and then you have to leave their country.
Okay.
After the medical education, if you want, you can further your education. They call it aspirantura, which is what the Americans call fellowship. So you finish medical school, you go into residency training, then go into fellowship training. So you can stay back and specialize in one particular area in medicine. So when we finished, we had no option. You have to either choose to go back, or if you want to read further your education, you specialize. You cannot work as a doctor and treat their citizens. Like I said, I don't know what it is today, but then that was it. So I decided that, okay, I want to further my education. So I decided to cross over to United States of America. And in US, it doesn't matter who you are, where you come from. If you did not do your medical school, college education in America, you have to first of all take the medical exam that the American trained medical students do take. So you have to prove that you have the same knowledge. That's what they call USMLE. So US Medical Licensing Examination, I believe. So you do step 1, step 2. Then by the time I was crossing over, then they introduced a new one too. They call it CSA, Clinical Skill Assessment. So I was among the first set of people to also do that during my crossover. It was I passed the CSA at the first attempt, but also where the first session was also scary. Looking at the fact that when you finish medical school in Russia, you actually did not have a good exposure of practicing before you start the process. But because of the training that we had, so this clinical skill assessment, it doesn't matter, medicine is medicine all over the world. The language may be different. So that kind of helped because of the training to help us pass the clinical skill assessment exam. So I crossed over, and then after I passed, I got admission to study primary care internal medicine. To do my residency training in primary care internal medicine. But before then, while I was preparing for those 3 exams, I was also working as a first surgical assistant at a cosmetic surgery center in Philadelphia. So that's where I gained all my experience of facelift, nose, lips, breast augmentation, tummy tuck, liposuction, And that really helped me because of the liposuction part. It helped me with my fat-derived stem cell therapy, because I need to do liposuction to harvest the fat.
Yes.
I can work on it to get the stem cells out. So, all these things end up paying off, even though I did not do surgical residency.
Yes.
But I already had over 2 years plus of surgical experience, being the first surgical assistant where I was working. So technically doing everything with my boss. But my training was internal medicine.
Good. So we're coming to regenerative. But before that, I noticed your wedding band. How is Madame? How many kids have you got? How did you meet Madame? You know, tell us, you know, this is like, you know, it's something to know about Dr. Ikudiasi. You know, how did you meet Madame? Where did you meet Madame? How long have you been together? How many kids have you got? You know, please.
All right. Well, for those that may be curious, my wife is in Nigeria, you know, and I have 3 kids, you know. So, my younger sister is also a product of FGC Iduani.
Okay.
And also got married to, you know, her husband, also FGC Iduani product.
Okay.
Both of them are junior. And so in 2002, I came on to Nigeria from US for the wedding. So it was at the wedding that I spotted my beautiful wife.
Amen.
So I'm like, then my elder sister, I told her, I'm like, you know what? You know, who is that girl? You know, try to get more information. So that's how where I found her. And then, you know, we dated. Because I was not based in the country, so we have to also do some the long distance relationship.
Yes.
You know, but in 2004, you know, sometimes I have to visit Nigeria, make arrangements so that she can come over. You know, and invited her to come over to the US. So right now we've been married for 17 years. You know, this summer will be 17 years that we've been married. We are blessed with 3 kids, wonderful kids, and we thank God everything has been working fine. We are both in medical field, so we understand each other's nature of job.
That's excellent. Thank you very much. So now we're coming to regenerative therapy, restoring hope to people who have regenerative issues. I've had an opportunity of going through your Glory Wellness Center website. How did that come about? I know you've been working. You were working as an assistant surgeon where you learned liposuction, the ability to take the cells out of the fat. And then what motivated you to create such a beautiful thing as the Glory Wellness and Regenerative Center? What inspired you to that direction? Where are you now? And what is your plan going forward?
Okay. When I finished my fellowship, you know, hold on, I'm not sure if my connection is. You can hear me now, right?
I can hear you. Yes. Yes.
Okay. When I finished my fellowship training in geriatrics, I decided to go into private practice. So I was working as an emergency room physician. I had my own practice, just a new, fresh doctor. Then at some point, during my fellowship training, I had the opportunity to take care of some cancer patients. You know, I did some electives in oncology, and then that exposed me to taking care of people with pain. Then, when in my own private practice, I was also doing, we call it like pain management. It was the pain management part of my practice that exposed me to regenerative medicine. I found out that, excuse me, I found out that instead of using medications to reduce or take away somebody's hip pain, knee pain, I can use their blood. So it's blood from the patient, no side effect, no risk of rejection. We call it autologous, means from you to you. So that's my first introduction to the world of regenerative medicine. Then I started getting experience, seeing my patients improving. And this happened at around 2013 or so. Then from there, using blood is called PRP, platelet-rich plasma, PRP therapy. So that's the first thing I learned in regenerative medicine, and I've been doing that since as early as 2013. There's a cosmetic part to it. You can use it to get rid of acne, get rid of fine lines, wrinkles, make people look younger. You can use it for, apart from pain in the joints, you can use for neck pain, back pain. It's very good for sexual function, both in women and in men. So women that are in menopause, that they've lost interest, they've lost desire, they're in pain when they're having intercourse with their spouses. They're always dry, they get great results. It's like when they were younger. Like you say, you check my website, on my Instagram and Facebook. Recently we have videos we uploaded for video testimonial from women, who have gained great improvements. Men are not left out. If there are many causes of erectile dysfunction, if it is not a psychological issue, if it has anything to do with either the functionality of the tissues, the private part itself, we can treat that using the patient's blood. So we call it P-shot, Priapus shot. That helps men, with erectile dysfunction. Although nowadays you can even add shockwave therapy, all these things are available in Nigeria, at least at the clinic where I work in Nigeria. Shockwave therapy, P-shot for men. It restores marriages, it restores relationships, it helps, like I said, women too. Now, anything you can touch, you can use PRP, platelet-rich plasma for. Then, after some exciting results experience in PRP, I decided to further my education, because these are things that were not taught in medical school. In adult stem cell.
Sorry.
Okay. So I decided to further my education in adult stem cell and therapy. And this is when you use the bone marrow, the fat, or umbilical cord, or you can even use the exosomes derived from bone marrow or placenta. So there's exosomes and there's adult stem cell therapy. When you use this, the cells from your fat in your stomach or bone marrow, you can, once you get these stem cells, you can introduce it where you want it. You can use it to treat acute stroke, spinal cord injury, diabetics, multiple sclerosis. Even you can still use it for arthritis, because they work better than PRP for arthritis. Remember, PRP is for what you can touch. Stem cells is for both what you can touch and what you cannot touch. So develop autism, cerebral palsy, all these developmental delays. Technically, when orthodox medicine say it is over, regenerative medicine is saying there is hope. And that has been proven, a lot. Now, for those that have heard of regenerative medicine before, or not really sure, or those are heard of stem cell therapy, you have to understand that there are some stem cell therapy that are still in research stages, can only be done at research centers. And there's a type of stem cell regenerative medicine that is called induced pluripotent, IPSC, induced pluripotent stem cell therapy. That is when you take a cell from the body, you reprogram it, you manipulate it, you expand it before you give it to the patient. So that goes through some weeks of reprogramming, culture expanding. That is in research stage. There's also embryonic, which used to be the first most popular stem cell, but not liked by many religious groups. It has ethical issues. Many countries ban it because embryonic stem cell therapy involves using embryos from IVF clinic, for example, and those are potential human beings. So when you start manipulating potential human beings, messing with it, many countries and religious groups are against that. So what is left now is induced pluripotent stem cell therapy, which is when you reprogram, you expand, you manipulate cells to do what you want them to do or to attack cancer cells. These are in research stages. So the third one, again, there is embryonic, there's induced pluripotent, and the third one is called adult stem cell therapy. And that is clinically safe. That is what I am involved with. That's when I say I do stem cell therapy, I mean adult stem cell therapy, which is one that is clinically safe, is clinically available. And just to clarify, the word adult is not about age. It's about fully formed human. That is why when you talk about exosomes from placenta, you only get placenta when the baby is technically being delivered, which is fully formed human. Or you talk about umbilical cord stem cells. It's when the baby is being delivered, you separate the baby, from the mother and cut the umbilical cord. So they all come under adult stem cell therapy. So it's not about age, but about fully formed human. So that's the three types of stem cell therapy. And a lot of Nigerians have benefited, well, don't let me say a lot, let me say few. Even people in the government level, some of my clients include one of the current sitting ministers, federal government ministers. He's running second time. He had a stroke, acute stroke. Within 14 hours of treatment, 50% of the symptoms were gone. He's looking stronger, younger, happy. A governor too, I had the opportunity of treating their son for cerebral palsy. They brought the kid to John Hopkins. John Hopkins said the age is too, because they like everything in America to be perfect. So he was outside the age group that they were served. So, we treated him. He couldn't stand up or walk. Even if you're holding him, he can't make a step. And after 2 sessions, right there in Nigeria, the documentary was shown 5 months later. He pushed himself up. He made that 6-7 steps. They had a foundation which they allowed me to speak. This is all on YouTube. Still, I'm not going to mention the name, but it's the public record. So the Nigerians are benefiting, is my point.
Yes, doctor. I've seen a lot of your some of your surgeries on your Facebook page, some groundbreaking elective surgeries, innovations. We are truly proud of you. Now, what is the motivation for setting up in Nigeria? Is it to give back? Is it purely business? Or is it to teach as well? Because after gaining all that knowledge from the best schools, like federal schools, being sent on scholarship to Russia, doing what you're doing in America at the moment, I suppose that's why you set up a center in Nigeria.
Yes. So, all those options you mentioned, is all included. Or business, giving back to the community, and also even helping some patients. For example, let me start with the latter. currently, of course, I still can't mention it. There is a multiple sclerosis um, and person who I heard about it about 8 years ago, but just vaguely, I moved on. Then about 2 months ago, I saw GoFundMe for this same person. So I'm like, what is going on? So I reached out to the person that posted the GoFundMe. That this person is already losing the ability to walk. The site is affected, everything. So I'm like, you know what? Just like you said, giving back. So I'm like, I will pick this case. So the first thing I did was I ordered, first of all, has any MRI be done? Because in America, there's nothing like MRI negative multiple sclerosis. In other words, there's no way you're going to have multiple sclerosis that it is not going to show on MRI. There are some conditions that you may have, but the test may be negative, but that doesn't mean that you don't have it. It's just that you are not being positive. But when it comes to multiple sclerosis, it will show on MRI. And MRI has not been done. She has been to teaching hospitals in Lagos there. But so I decided, okay, this is what we're going to do. We did MRI of the brain, the neck, the upper back, thoracic, the lower back, spine. When I got that done, I sent the person to see a professor, consultant, or of LUT for high examination. Then another top-notch neurologist in Lagos. So she saw him, and I think Monday is another follow-up. These are all the things that I pick on my cards. Okay, yes. I pay for the consultation, all of these things, the MRI, everything. And when all this is being said and done, I'm going to treat this person because on my this thing too, there's a lady with multiple sclerosis who could not walk straight within 8 days. When she came back for her second dose, was able to walk straight. About 3 weeks ago, color vision is now sharp, which was blurry, diagnosed in 2016 in Nigeria. So there's regeneration going on in that person. So I know I can also help her, and she cannot afford regenerative medicine. So that's why. So I have cases that are pro bono. The other one is paralyzed for 2 years from the neck down. Playing another kid in Abuja, playing in secondary school, wrestling, head down, crushed. So the neurologist did evacuation surgery, and then, and from there, that's the saved his life, but he was paralyzed downwards.
Yes.
So I got involved. In medicine, once you are paralyzed for more than 15 months, nothing coming back. The neurologist said, don't waste your time. Top neurologist, is a friend of mine, and he worked with the president's son in Nigeria, so he's top neurologist. But I said, I waited. 9 months after getting involved, the kid was able to move his hand. 12 months able to move the left hand. 15 months was able to turn his waist. The only challenge is that he had the problem for 2 years. Chronic issue, scar tissue formed. The kid with similar, it was 17 at the time of injury. The clients or kids with similar problem, they are treated within 6 weeks during the acute, we call it acute in medical world. They have the chances of full recovery, able to walk by 2 years later. So yes, I was able to regenerate, some things, make him to move, but it would have been lovely to help him to be able to walk. That's another problem we have in Nigeria. We don't seek help on time. I understand the healthcare industry is expensive, but we wait till things are old, chronic, and going out of hand before we start running to hospitals. Here in America, we have preventive medicine. If there's nothing wrong with you, at least once a year, go and check. Your blood pressure may be normal. Last year, stress in life, bills or whatever, anything, food, gaining weight, anything could have made your blood pressure to be high, which was normal last year. And then you start becoming a candidate for stroke if you don't know, and keep going up. So those are the preventive medicine is very important in Nigeria. If people just see a doctor and don't believe that I'm fine, nothing wrong with me, I don't go see a doctor. Because by the time you decide to, it's too late. You know?
So you've given us great examples of your work that you're doing pro bono. These are the things that my website, The New Nigerian, tend to want to highlight. Are any of these documented? Because by the time we finish our podcast, we will write an article about you. We will write an article about your clinics, and we would like to specifically highlight these forms of giving back. It's a form of bridging the gap between our best in diaspora and back home, you know, and these are things that Nigerians need to know. These are things that Nigerians need to appreciate of their own. You know, every time we keep hearing all the bad things going on in Nigeria, you know, we hear, oh, there are killings here, people are suffering, but they don't get a chance to actually hear and see that we also have the best. We do. And that's the truth. And this is what I tend to want to highlight. Yes, everything is hard, but there is hope. As long as we have the best willing to give back, who give back actually, we just need to highlight this to our people, encourage them to work harder, and see where we go from there. There is always hope for the next generation.
That is true. And if I may even comment further, for example, okay, first of all, to answer your first question of evidence, the multiple sclerosis, the lady that I mentioned earlier on, yes, has had the MRI done, has had the high doctor visit, has had the neurology first visit, the next visit is this coming Monday. You know, yes. As the initial plan was when she came to my clinic in Lekki, I asked my doctor on ground to do certain things. The plan was to give one of the procedures of regenerative medicine based on, and the information I had, but only to be told that there's no MRI, only to be there's no medical record before. They lost it in one of the universities because they were using that for teaching rounds, according to her. I'm not going to mention it here. So I said, no. Hold off. I'm not going to treat. I need documented evidence that what I'm treating is multiple sclerosis.
Yes.
I know it's America. Yes, because of fund in Africa, sometimes we just base it on clinical only. Here, you have to, like here, for example, they will not give you treatment for malaria. Even if you are coming from Africa and you have the symptoms, you will not get, you'll be treated. Don't get me wrong, you'll be admitted, but you will not get that treatment for malaria started until it is confirmed under microscope that you have a malaria parasite. So, but in Africa, especially in Nigeria, you come, I know we've treated a lot of malaria, so everybody see that type of the malaria, it doesn't, it won't happen like that in America. So I decided I'm not going to start my treatment for multiple sclerosis until I have MRI. And no MRI was done. So, MRI of the brain is expensive, MRI of the lumbar spine is expensive. So what I ended up doing is that I took it on myself. I know they can't afford it, and not even the regenerative medicine, because regenerative medicine is not really that cheap that a bus driver can just go I mean, there's some of it like wound care, joint pain, but there's other ones that are expensive. But we'll get to that later on. But my point is, documentations of all those things has been made. Visit to specialists has been made. Then, after the follow-up on Monday, I will with the neurologist. I will let everybody do what they need to do before I have to come and do my own regenerative medicine part to help with that. So that documentation is there. What brought me, I think you also had the question earlier, what brought me back home?
Yes.
Is I didn't come back home to compete with any of my colleagues to start doing primary care, treating malaria or typhoid. No. We have enough good doctors in Nigeria. Regenerative medicine is a relatively new area of medicine.
Absolutely.
20 years or plus old. This is a knowledge that can save lives. That orthodox medicine says, we are done, deal with the rest of your life. Regenerative medicine is saying there may be hope. And I give examples of the federal government minister, governors, all these things. Yes. That is why I came back to Nigeria to be able to assist. Like the governor, not everybody has the money. The governor came to US. Well, not the governor, the governor's wife and the kid rather. Well, the kid to the US, they're not concerned, we can't help you. But not everybody can come to the US. Even though they have the money, they couldn't get here. But, because of some restrictions, this thing, I'm like, no, there's hope. I came to Nigeria, I was
to give hope.
They found out about me, and I was able to help. But again, for every problem, the earlier the better. I mentioned stroke. There's difference between acute stroke and chronic or old stroke. Okay, last year, September 2020, a lady had a stroke on Sunday. I was in America. They called me. They said, we need your consultation to assist. By Friday, I sent my doctor to that hospital to give one of our regenerative medicine procedure. Paralyzed on the right side, unable to talk since Sunday. After treatment on Friday, on Saturday morning, she started talking.
Oh.
If she had not got regenerative medicine, either she may not be able to talk, or she has to go to speech therapies, which is normal, which is still get physical therapy and occupational therapy, despite regenerative medicine. You still need rehab, okay? Don't get me wrong. But getting regenerative medicine was able to prevent the nerves, the brain cells from dying, reversing the process because it was done during the early acute stage.
Yes.
So the regenerative medicine works best when you catch it early. Early diabetics. Like on my website, there's a lady, not website, on the social media, Instagram and Facebook. There's a lady in Lekki who also popular school, a school principal owner. She gave out her name. She had diabetic. Got one treatment. She was diagnosed around 4 or 5 months. She got treatment. One session. She's not taking medication anymore.
She's diabetes free.
The diabetes is controlled. I don't want to say diabetics free because we don't like using the word cure. CURE in regenerative medicine, we don't want to say cure. Okay. We call it incremental improvement because everybody's going to respond differently. But my point is there's another client that I've treated, I think about 2-3 times now for diabetics. The sugar, everything is perfect. Energy, sexual function, everything great. But he wants to get off medication. But he has been diabetic for a long time. So my point is everybody responds differently. And then the earlier you address your issue, the better your chances of full recovery, the less the number of treatment sessions you need.
Yes.
That's what is important for people, because everybody is looking for miracle drug. In regenerative medicine, don't promise any cure, miracle. But if you treat your condition quickly, even for kids that have autism that are responding, they are doing better than the older 20-something-year-old. But those one we need more treatment than the kids.
This brings me to our bridge, to our need. If you remember, a couple of days ago, I sent you a message about a lady,
Yes.
and you came back to me, correcting me, letting me know that that wasn't part of your specialty. Now, I have a lady whose son has cerebral palsy.
Okay.
He's in a wheelchair. He responds most to her voice. She's done a few YouTube videos for me, and just getting to know her a bit better, that was how I found out that her son has cerebral palsy. This was 2 weeks ago. Now, I don't know. I believe very strongly in fate. I don't know if you're opening up to me, you're accepting my request is part of fate. But I promised his mom that any opportunity I got to speak with you after going through your website, that I would ask, because her greatest desire is to help her son. Now, she's planning to relocate to America. Her paperwork is slow in coming. But here we are. I have the exact man in front of me. I want to bridge a gap. I will document. We could make a documentary out of it. But, Dr. Ikudiasi, can you see my boy? Now, financing. I promise you, we will raise finance when it comes to that. If we need finance, we will raise it. But as a proof of what we are able to do, a proof to help the mother whose biggest desire is to see the betterment of her son. Now, I have a recording. I said to her I was going to delete that part of it because we talked face to face like we're talking now. I said to her, I'm going to delete it, but I will be very happy to let her know that I'll send that to you so you can have a listen to how a mother's love is for a child, so we can prefer a solution. Like I said, I'm quite sure that a GoFundMe page is not far from us or from anybody. And with the quality of people we have, I'm quite sure that if it comes to funding, we will be able to raise funding to see what we can do for that child. His name is Dende.
No, what the fuck, remember you said that you are recording. So
yeah, I'll edit that. I'll edit that out.
Or And how old is this kid, and where is the kid located?
He's in Benin.
Okay, it's in Nigeria.
Yes, in Nigeria at the moment. He is now, if my memory serves me right, I think he's between 12 and 15.
Okay. Between 12 and 15?
Yes.
The governor's kid that I treated was 9 years old when we started the treatment. Now, by the time he was able to push himself up and make 6, 7 steps. That was 5 months from the time we started, and the treatment has been done 2 sessions every 3 months apart, and we planned for 4 sessions initially, which we completed. But from the go, I told them that we might need 8 sessions every 3 months, but let's start with 4. Remember, I said the earlier, the better.
Yes.
Just like the minister, the federal government minister that got stroke, or the 2020 September last year, 2020 patient that couldn't speak within 6 days was able to speak within 12 hours of treatment. When
Yes.
anything that has to do with kidney or the central nervous system means the brain and the spinal cord. So kidney, central nervous system, they both need multiple treatment sessions, especially if they are chronic, that is problem of more than 3 months. Cerebral palsy means a section of the brain is already dead. It's either because of lack of oxygen or jaundice during birth, or as still at the end of the day, deficiency of oxygen in this case,
Yes.
whatever the cause may be, and that is, and so it's like somebody, an adult with high blood pressure will develop a stroke. Then after 2 years, we find that the section of the brain is dead nerve cells there. So same thing with similar thing with cerebral palsy.
Yes.
The way regenerative medicine helps is that the inflammation around the dead area of the brain will be reduced, toned down. So initially they get some improvement from that reduction in surrounding swelling. Then the adult stem cells start doing cell-to-cell communication, telling the cells around the dead area to multiply, then at one point also to differentiate, to replace the function of the dead tissue, and then slowly, gradually, over months or years, to absorb the dead tissue so the size will shrink. So that is why their improvement is going to be slow and gradual, and we need continual transplantation of stem cells.
Yes.
It could be umbilical cord stem cells, or if it's 12, 13, and it has fat, you can even use its own fat as well. But my point is, it's not a one-time treatment, it's not a 2-session treatment, because it takes average of 9 to 12 months to even get functionality back in some of the old damaged nerve areas.
Yes.
Multiple sclerosis respond faster. Because that multiple sclerosis also is a problem of the brain and the spinal cord, but is considered to be caused by autoimmune condition, the body attacking itself. So by turning down the body's autoimmune process, modulating the immune system, you allow the body to regenerate. Otherwise, the body is attacking itself, it's not allowing the body to regenerate. That's what is going on with multiple sclerosis. So they just continue to deteriorate. When you introduce regenerative medicine, that immune system being modulated, giving the body a break, so the body can now repair, regenerate itself, and regeneration is started. So for cerebral palsy, is a dead area of the brain that we are now trying to stimulate the nerves around it to multiply, differentiate, to replace the function of the dead one. And over the time, slowly the body absorbs the dead area, and then it starts shrinking. So it requires, at age 13, it's going to require close to 8 sessions.
Right.
And each sessions, are not cheap until recently, which brings me back to when we're talking about business, giving back to the community and all this.
Yes.
See, I've been coming to Nigeria, I think, since 2015, April or 16 with this regenerative medicine every 3 months. I've been advocating for Africa, or Nigeria in particular. I've been asking all these suppliers in America that Nigeria is not buoyant. We are poor. If there's a way they can help us. Some of them, not all, some of them have been able to give us a good discount, which we now passing on to our clients. So that's why starting from middle of May this year, 2021, some prices are going down by 20%, some by 30%, and there are some that are actually, truly, really 50%. The only challenge we have is that all these products, all these supplies, even we bring everything from US, even clean our syringes and gloves, but all these products are based in dollars. When we come to Nigeria to convert it to the Naira, yes, there may be 50% in dollars, but our Naira that keeps losing value now and then. So for someone who was told the price 2 months ago or 5 months ago and being told the price this month, we say yes, that is 50% reduction. Someone who was told the price in Naira maybe about 4 years ago when dollar rate was lower. And now at 50% reduction in dollar, and you now tell them the price, yes, technically the price will be lower, but the difference to that person in Naira may still not be much because the dollar rate went up. So let's say they were being asked to pay 10 Naira before. And now the same dollar equivalent is 15 Naira. So if you say 50% to somebody you took 15 Naira 6 months ago, that's 7 Naira 50 kobo. That's 50%. But somebody who was told 10 Naira 6 years ago, before dollar made it to be 15 Naira, you tell them, oh, the price has gone down by 50%. How much is it? Is it 7 Naira?
Which is an increase. Yes.
So to him, yes, you are giving him a reduction in price from 10 Naira to 7 Naira 50, but that's not 50% to him. No. That's like 25%.
Yeah.
But the one that the price has been, the Naira has been consistent the last 6 months, who was told to pay 15 Naira, and you now tell him 50% off, we agree with you that it is true. So because all these things are from US, yes, there are some things that are 50%, some 30%, some 35%, some 20%. We've been able to do some achievement, and we are passing all this onto the clients. So some things have really become affordable, but some, like in the stem cell part, are still expensive for an average school teacher. But arthritis, your own blood, sexual function in men, sexual function in women, getting rid of scar tissue, acne scar on the face, wound that will not heal, chronic non-healing wound, you put all the on it, blah, blah, blah. All these things can be taken care of at a very, very reasonable price. Some are 30%, So I just want to throw that out there,
Yes.
that cerebral palsy is not an easy, cheap treatment. But there is hope. It's just that it requires multiple treatment sessions.
Yes. The new Nigerian will strive to meet up, because we will also try and document it in form of a documentary. That will kind of be like, how will I explain it now? Sometimes when you watch BBC or you watch CNN, they follow a path of someone who has had a problem, you know. Maybe that's money generating as well at some point. But the important thing is to first of all prove that this gap can be bridged, that
Yeah.
there is an opportunity for that child to see a specialist in Nigeria without going abroad. This is also a highlight. This is also opening the market up for people who have not been aware of
it's possible in Nigeria.
Exactly, sir. You know, so
and actually, let me to cut you. There's even another thing pipeline.
Go on.
We're also working with a company to help us set up some of these stem cell stuff in Nigeria, so that way the production will be less, and then it will be more affordable for the
indigenous, the local people.
And then we have, the company. I'm trying to see how their product can help the sickle cell. We have a lot of sickle cells in Africa. In Europe, they don't have that much, so it's not their own. It's not their own disease.
It's not.
You understand? So they can't invest so much on it anyway. But things are in pipeline. We're working on stuff like you reach out to me for cancer.
Yes.
I brought a project to Nigeria whereby you can use the patient's fat, the stem cell from the fat, mix it with a vaccine, and then inject it into the tumor, the solid tumor, whether it's in the neck or wherever it is. I got the radiology interventionist that will help us guide the wire and do everything, who is now related, American trained. I went to NIMA, National Institute of Medical Research. The company that is currently doing the research in UK, Germany, and USA, the innovator, the man who invented the program, because it's now in stage 2 going to 3, promised me the blueprint. All I needed is to let him know, is it the German vaccine or the US vaccine that we have in Nigeria, so that he can tell me which blueprint to release. And he has to make sure that we have the vaccine before we go any further.
Yes.
I told you I already do stem cell from the fat, so you know that area is covered. Vaccine is ready-made. But we start to do a research that mixing them together, stem cell and the vaccine, we cure. Yes, I know I'm using the word cure now. We cure the cancer. But these are things that are in research stage, not clinical.
Yes.
Individually, vaccine is safe. Adult stem cell from the fat is safe, clinically proven. But mixing them has to go through research.
Yes. Science is sorry, go on.
Yeah, we couldn't go further because we could not get the vaccine we need in Nigeria. If that is possible, when you contacted me about the cancer, I would have just told you, enroll that person in the trial. The results are beautiful. I presented that in 9 months. But, we don't have the vaccine, so that's where that stuff. So the bottom line is that there's hope.
There's hope.
As we continue to fight to reduce price, to make it affordable, we'll get there one day. We're also telling people to come and produce some things. And when this comes, we have to go to NAFDAC. We get permission from that. I mean, there are things, anyway, don't let me get into that. We follow the protocol of things that needs to be done.
Yes, absolutely.
Even COVID-19.
So talking about NAFDAC, one of your classmates is a director in NAFDAC, Enna Umeni.
Yes.
You know Enna? Yes. Yes. We'll let you go now. I'm very grateful for your time. It has been a very interesting and knowledgeable session, which I'm sure after editing will benefit quite a lot of Nigerians. With my young boy, I don't know if I can keep reaching out on WhatsApp so we can discuss the next stage. I'm going to go back to his mom now and say, Dr. Ikudiasi told me there's hope. I wait to hear the next stage from him, even if it's just a consultation initially?
Yes,
Just to,
there's going to be need for registration, consultation. Then I was to explain. I have a recorded video, which I think I've sent to you. They can watch of what I do, so they have an idea of what to expect.
brilliant,
So,
brilliant. I'll forward all that to her today. I'm going to stop the session by saying thank you for your time. You're such a busy man. We know it's not easy for you to give your time to us, but we are so grateful for it.
Thank you, my namesake.
Thank you, David. No problem. Take care now. My regards to all. Bye for now.
Bye.